The benefits of CBD and THC. You've probably heard a lot about cannabis and marijuana products as they become legal in more and more states. Two natural compounds have received the most attention, CBD and THC. Hello friends. Welcome to my channel. In this video, we are going to discover the benefits of CBD and THC. Cannabis is a plant that produces a solid substance full of compounds called cannabinoids. There are more than 100 of these chemicals in cannabis. They cause drug-like reactions in your body. CBD, cannabidiol and THC, tetrahydrocannabinol are the most common cannabinoids found in cannabis products. If you are curious, watch till the end. Cannabidiol, commonly known as CBD, is the second most abundant chemical compound found in cannabis. First discovered in the 1940s, CBD has recently become more popular as a natural treatment for a variety of conditions. It can be obtained from hemp or marijuana. Hemp-derived CBD still contains trace amounts of THC, while marijuana-derived CBD may contain more. Delta-9 tetrahydrocannabinol, or THC, is the main psychoactive ingredient in cannabis. According to the National Institute on Drug Abuse, THC activates the brain's reward system by signaling the release of the brain chemical dopamine. Dopamine is a neurotransmitter that plays an important role in mood and happiness. By triggering a higher than normal release of dopamine, THC causes people to experience feelings of euphoria. THC is most often administered by smoking marijuana, but it can also be found as an ingredient in capsules, edibles, and oils. Because THC affects the brain's reward system, THC can also be addictive. About 30% of people who use marijuana develop an addiction. This risk is much higher for those who start smoking marijuana as teenagers. CBD has been advertised as providing relief for anxiety, depression, and post-traumatic stress disorder. It is also marketed to promote sleep. Part of CBD's popularity is that it's meant to be non-psychoactive, meaning consumers can get the plant's health benefits without the high or midnight pizza munchies. As hemp plants are sprouting up across the United States, so is marketing. From oils and nasal sprays to lollipops and suppositories, there seems to be Northwest's sacred place for CBD. Both CBD and THC have the same molecular structure, 21 carbon atoms, 30 hydrogen atoms, and 2 oxygen atoms. A difference in the way the atoms are arranged causes different effects on your body. Both CBD and THC are chemically similar to endocannabinoids in your body. This allows them to interact with your cannabinoid receptors. Interactions affect the release of neurotransmitters in your brain. Neurotransmitters are chemicals responsible for sending messages between cells and have roles in pain, immune function, stress, and sleep. Everything we care about has a huge impact on our daily lives. A high CBD to THC ratio has been studied to reduce the negative psychoactive effects of THC, reducing confusion and anxiety symptoms related to what people might consider a bad high. This may be because CBD is an antagonist, meaning it blocks signaling to cannabinoid receptors, as opposed to an agonist that activates them. One subtype of those receptors is CB1, which is widely distributed in the spinal cord and peripheral nerves, and brain. They regulate the release of neurotransmitters such as serotonin, dopamine, and glutamate. Synaptic plasticity is important for learning and memory as well as motor function, although it not only regulates mood but also perceptual cognition. Another subtype is CB2, which mainly focuses on the immune and gastrointestinal systems. They are not as densely expressed in the brain as CB1 receptors. When THC and CBD are used together, it increases the ability of cannabis to affect different areas of the body, improves absorption of the active ingredients, and minimizes negative side effects. Low and slow is the general rule of thumb for cannabis product dosage. Understand that your consumption pattern will also change at startup. Edibles take about 2 hours to metabolize, and direct inhalation is immediate. The initiation time of a vaginal suppository is between 15 to 30 minutes, but unlike edible suppositories, a vaginal suppository bypasses the digestive tract and liver and relies solely on body temperature to melt at a specific rate for absorption into the surrounding skin. Subs allow you to use more THC without the usual psychoactive high. Thus, it is very important to research the expected response time, wait for the full duration of the cannabinoid to take effect, and get a feel for things before moving on to another dose. Some studies show that the golden ratio is solid 1:1. Listen to your body and take the time to adjust accordingly. Start with a very low THC percentage and work your way up, especially if you're new to cannabis. The dose is extremely important as hyperactivity of CB1 receptors through THC can cause temporary discomfort. Confusion, anxiety, hallucinations, or delusions can be caused by an overstimulated endocannabinoid system. Excess cannabinoids flow from parts of the brain to the brain that regulates fear and related emotional responses. However, this is not the case with CBD, which has a lower binding affinity. Thus, taking THC and CBD together is enough to provide you with the pain and symptom relief you need. THC and CBD are present in both marijuana and hemp. Marijuana contains more THC than hemp, and hemp has more CBD. In recent years, interest in the potential health effects and benefits of cannabis has grown. Much of this interest has centered on these two cannabinoids. This interest will grow as cannabis and marijuana products are legalized in more states. A number of different products have emerged that contain CBD, THC, or both. Such products are designed to relieve stress, anxiety, and insomnia. Although THC and CBD may have benefits, it is important to note that much of the research on these benefits is in the early stages. More research is needed to determine how and when CBD and THC can be used to relieve different symptoms or treat different conditions. In order to understand the effects and potential risks of these products, it is important to understand the differences between CBD and THC. THC and CBD affect the endocannabinoid system, which plays an important role in maintaining homeostasis. Researchers are still working to understand the ins and outs of this complex system, but they know it is involved in processes including memory, appetite, sleep, mood, and fertility. There are very few side effects with CBD or THC. According to the World Health Organization trusted source, CBD is generally safe and does not appear to have any potential for abuse or potential for harm. The Food and Drug Administration's reliable source adds that side effects can be a result of interactions with other medications a person is taking. It may also have some effect on the liver and male fertility. A person using THC may experience some temporary side effects. These may include dry mouth, red eyes, slower than normal response time, a general sense of superiority, memory loss, problems with coordination, increased heart rate. Adolescents, especially, can experience adverse psychological effects from getting high. This is because a teenager's brain is still developing. According to some research, regular or large doses of THC may increase the risk of developing schizophrenia in some people who are predisposed to the condition. Neither CBD nor THC have any serious side effects. Can't be fatal when taken correctly. Also, people who use THC recreationally seem to have a lower risk of addiction. Generally, drug tests are designed to detect THC, not CBD, in a person's system. However, depending on who orders the test and what they use the results for, a drug test can also be used to look for CBD. It's important to note that if you use hemp-derived CBD products that contain legal amounts of THC, no more than 0.3%, THC can still be detected in a drug test. If you want to use CBD products without this risk, researchers suggest using broad-spectrum CBD or CBD isolates, both of which exclude THC entirely. You may want to consult a medical professional about the use of CBD or learn more about the specific drug test you are taking. Both CBD and THC help manage sleep disturbances and physical pain. CBD is especially often used to relieve stress and anxiety. Clinical studies have shown that a mixture of THC and CBD can help manage the symptoms of post-traumatic stress disorder and amyotrophic lateral sclerosis. You should always talk to your doctor first before you try any products containing THC and CBD and check the legal status of such products in your state. Both CBD and THC hold promise for relieving symptoms and treating some medical and mental health conditions, but research in this area is still relatively new and requires further investigation. While CBD is not addictive, THC is. Many CBD products contain higher levels of THC than the label suggests. Unfortunately, many flying companies in the CBD space are looking to make a quick buck. One way they do this is by advertising their full spectrum of products but only selling CBD isolate extract. The only way to verify what you are getting is to refer to the product's certificate of analysis. This should be done with an accredited third-party lab to avoid bias. It must list the concentration of cannabinoids along with cannabis terpenes. If the certificate of analysis lists only CBD and nothing else, you know you're not getting a full spectrum product. Be sure to do your research before you buy. So, that's all for today. Thank you for watching. Follow for more.